Welcome to a presentation on StarMed benefits. Today, I'd like to talk to you about our company, our 3 affordable benefit plans, and our easy enrollment options available to you as an employee of your company. We are excited to be partnering with your company to offer you these plans, and we look forward to welcoming you to the StarMed benefits family. As we introduce these 3 benefit plans, please refer to your StarMed election form, which will give you your company's pricing on all of the plans we talk about today. Please keep in mind that all of our plans will be offered to you during your open enrollment period with your company. Every 12 months, you'll have another open enrollment, and this will offer you the chance to either upgrade or make changes to your coverage as necessary. As we get started, I'd like to tell you a little bit more about StarMed benefits. We're similar to a traditional health insurance company, but we're not actual health insurance ourselves. We're a more modern take on traditional healthcare. Our programs still can give you access to doctor's visits, specialist visits, urgent care coverage, vision coverage, and so much more. But we've chosen to specify our benefits programs to give you the most value for the least cost possible. You might see advertisements for health insurance companies on TV, on the road to work, or online all the time. But here are a few things that make us stand out from all the other healthcare companies that you hear about every day. First thing is that we include unlimited telehealth services to all of our members free of charge. And what does that mean for you? That means unlimited doctor's visits from the comfort of your home, by phone or by video conference. That means you can see a doctor when you're on the road or when it's after hours and your doctor's office is closed. You can see them as many times as you want with no copay, 24/7, 365 days a year, for you and any family member that's on this plan. And the second thing that I love about StarMed benefits is that there are no deductibles with any of our plans. Now, usually with a healthcare plan, you would have to pay a monthly premium that could be very high, and then you'd have to meet a deductible that could be thousands of dollars before your health insurance company would start paying your claims. Not with StarMed benefits. We start paying claims on covered services from the first dollar billed. That means no deductible the very first month you start with us. Now, I need to make a very clear distinction here. We are not traditional health insurance. What we've done instead is to provide benefit packages that include about what 80% of Americans typically use on their health insurance programs. And what we've done is package those rates at an affordable price point so that on your monthly basis, your fees are low and your value is high. So how do we offer these healthcare plans if we're not a traditional health insurance company? Well, we use a process called self-funding, and we act as your third-party administrator to make sure that your healthcare fees work for you. Essentially, your monthly membership fees would be deposited into an account with StarMed benefits. We use these pre-tax dollars to pay for your monthly subscriptions to your telehealth, access to our PHCS network of doctors, prescription discounts, any incoming medical claims, and administration costs. We use our negotiated partnerships with our providers to make sure that you get the most for your healthcare investment. So let's get started on the fun part. Today, we're offering you 3 main benefit plans: our basic plan, our mega plan, and our ultra plan. Our basic plan is our most affordable package. It includes preventative health benefits, and it meets all of the requirements to be Affordable Care Act compliant. We've also included telehealth with this package and prescription discounts. Our mega plan includes everything that we'll discuss in our basic plan, but it also includes some significant upgrades. This is one of our most popular plans because it's still very affordable, but it allows you to see a doctor, see a specialist, have urgent care coverage, have vision coverage, and so much more. Our ultra plan includes everything that we'll cover in our basic plan and our mega plan, and it's as close as you can get to traditional health insurance with StarMed benefits. We've even partnered with a third-party health insurance company to offer you coverage on critical illness, hospitalization, and accidents. So let's start with our basic package. We include preventative health benefits for wellness checkups. This includes 15 covered services for adults, 23 additional services for women, and 26 additional services for children. These preventative health benefits cover all of your standard vaccinations, screenings, counseling, as outlined by the government standards in the Affordable Care Act. A full list of these benefits can be found online on our website for you to review. In addition to the preventative health benefits we discussed, our basic plan also includes unlimited telehealth to you at no additional copay. Essentially what this means is it's a visit with a medical provider by phone or by video chat from the comfort of your home, or if you're on the road, or if it's after hours and your doctor's office is closed. You can use this telehealth service 24/7, 365 days a year. That means no germs in the waiting rooms. That means not having to be there at a certain time or to have a super long wait before you get to see a doctor. It is convenient and it is simple. So here's how it works. You can either go online or use your mobile app to enter your symptoms and request a visit with a provider. That doctor or medical provider will reach out to you by video conference or by phone and listen to your symptoms and offer treatment options. If needed, they can even call in a prescription to your nearest local pharmacy. I should mention that all of our medical telehealth services are provided free of charge with no copay. But if you're interested in reaching out to a behavioral health representative, we offer that as well for just a $60 copay per visit. You might be surprised at all of the conditions that telehealth can actually treat over the phone or on video conference. Take a look at just some of the conditions that they're able to diagnose. Now, if your medical provider does call in a prescription to your local pharmacy, we also include a discount prescription card that can get you 20 to 80% off of your prescribed medications. We even offer discounts on compounded medications. And if you're interested in finding the lowest price possible for these medications, you can go online to starmedbenefits.org and use our prescription discount lookup tool. Simply type in the exact prescription that the doctor has prescribed for you and search by your zip code to find the closest pharmacies to you with the most discounted rates. So let's talk specifically about our mega plan. It includes everything we've discussed so far, and it also includes office visit assistance that allows you to see a doctor, a specialist, or a chiropractor in office for a minimal copay. We also offer vision care so that you can see an optometrist once a year for a checkup and have $100 to use towards glasses or contacts. Also included in this package, we pay up to $1,500 in billed charges for lab work and $1,500 in billed charges for outpatient testing as well. What's great about this in-office visit assistance, you have access to use the PHCS Multi-Plan Network of Doctors, which is the largest association of doctors in America. If the doctor you're currently seeing is not in the PHCS Multi-Plan Network of Doctors, you're welcome to continue seeing them with no additional charge. We prefer that you use the doctors in network, but it's never required. If our mega plan is what you're looking for, but you'd like a little bit extra coverage, we also offer dental and emergency room coverage upgrades as well. Dental coverage can be added, and it includes 2 visits with a dentist per year. Additionally, it allows you up to $1,500 in billed charges for covered services. These are non-cosmetic services, and a full list of what we cover can be found online. Our emergency room coverage allows you to visit the ER twice per calendar year with a $500 copay. And we include up to $7,500 in billed charges that are included in this plan. Our Ultra plan includes everything that we've discussed in our basic plan and our mega plan, and it also includes increased office visits and increased maximums on billed charges for lab work and outpatient visits. The dental coverage and emergency room coverage that were optional for the mega plan are now included in the Ultra plan. And we've also included some supplemental based insurance policies that will provide extended coverage for our members and their families. Our first supplemental policy is for critical illness coverage. If you're diagnosed with a new medical condition while under StarMed's care, you'll be reimbursed for your expenses for up to $10,000. Our second supplemental policy is for accident coverage. This includes things like broken bones, sprains, contusions, and even appendicitis. And this also includes a cash reimbursement. For this policy, there's a list of covered accidents and what their coordinating cash payout would be. Our last supplemental policy provides you with hospitalization coverage so that you would get a payout of $1,000 per day for up to 180 consecutive days for a stay in a hospital. These three benefit plans are the programs that the majority of our healthcare members take advantage of at StarMed Benefits. But I should also mention that your company is providing you with an MVP plan in compliance with all Affordable Care Act regulation. The total monthly premium for the MVP plan is 9.86% per individual employee's monthly gross income and $620 per dependent per month. Please note that this offer of coverage does not extend to an employee's spouse. This offer of coverage is extended to eligible employees and their dependents as mandated by the ACA. This MVP plan has a deductible of $7,500 per member per year and an out-of-pocket maximum of $15,800 per family. If you'd like more information about this program, please contact your StarMed sales rep. Once you've selected a benefit plan and you're ready to enroll, StarMed Benefits offers you 3 easy ways to elect for coverage. First, by paper. Second, by phone. And third, you can enroll online directly from the StarMed Benefits website. Just go to starmedbenefits.org to begin your process. From the homepage of the website, click on the Login button on the top right corner. Select StarMed from the drop-down menu. Click on Employee Login and enter the information requested. Check with your employer to find your employer ID information. Then, click on the button to complete your election form. Select the appropriate option to provide coverage for yourself or coverage for yourself and any dependents. If you still have questions about which benefit package is right for you, you can click any of these buttons to learn more about the plans that we've discussed today. Once you have chosen your options, click Continue to elect coverage on the plan and options you've selected. The screen may prompt you to ask if you have any coverage options currently in place with any other healthcare providers. Please answer the question. If you have chosen to add coverage for any family members, please click on the link that says Add Dependents at the bottom of the page. On the following page, you can individually add each dependent by clicking on the Add Dependent button. Enter the information in all the fields that are required. Next, you will be prompted to click on and to review your election form. After you review, you can either start over or choose to submit your form. Then, please sign and agree to the terms. Once you're finished, you can print your election form if you'd like a copy, then click OK to submit your application. New StarMed members should receive an email to confirm that their application has been submitted. If you don't hear from us within 24 to 48 hours, please give us a call to make sure your application did go through. Once your application is processed, you'll be given your login information so that you can access your account directly from the StarMed Benefits website. Please watch your inbox for more information regarding how to log into your account online and what you can expect as a StarMed Benefits member. As we close out this video, we'd like to leave you with a few thoughts. Our members typically love working with StarMed because we are a simple, modern way to have access to healthcare benefits today. Now, it's true that all of us probably worry at some point that we may get sick, or that maybe some of our family members may get sick. And at that point, you need to have access to healthcare in order to get better and make sure it doesn't get worse. We all have family or friends who have gotten sick and either haven't had healthcare and are swimming in debt, or have had healthcare and they've had help to pay the bills that come in that are unexpected. StarMed Benefits can give you peace of mind by offering you a low monthly cost for your healthcare benefits. And they're $0 deductible, so you don't have to worry about budgeting as much for those unexpected occurrences that come up for medical emergencies. Additionally, if something happens to you while you're on a StarMed Benefits plan and you find yourself needing more coverage, we'll work with you to help you transition to either a plan with StarMed that provides more coverage or a different health insurance company. At StarMed Benefits, we'd love the opportunity to serve you and your family by providing you with quality benefits at an affordable cost. Thanks for watching.